Hello, everybody. My name is Steve Canellis. I'm the Region 5 Chair for Aiea, Pearl City, Moana Loa, and parts of Waipahu. Today, we have a very good meeting today. It's about elderly care. We'll be talking to KEALI'I Lopez with AARP, DERRICK ARIYOSHI with City and County of Honolulu Elderly Affairs Division, and our favorite, Debbie Shimizu, who's with the State of Hawaii Executive Office on Aging. Debbie, you can.
Hi, everybody. Good to see you. Some familiar faces. So Steve asked me to put this little forum together so we could talk about the resources in the community and how you can access care for your elderly loved one. So I asked KEALI'I Lopez, she is the director of AARP, and DERRICK ARIYOSHI from the Elderly Affairs Division, and I'm with the Executive Office on Aging. So we have the state, the county, and nonprofit, which is a national organization. So I think we have a good group to give you lots of information. We're gonna just present a little bit, and then we want to open it up for questions. So I'm going to just do a little introduction about KEALI'I and DERRICK, and then I'm going to talk about what the Executive Office on Aging is doing. So KEALI'I Lopez is the State Director of AARP, and AARP is the largest nonprofit, nonpartisan organization in the country with over 30 million members across the country. AARP's mission is to empower people to choose how they live as they age. KEALI'I is especially honored by the role AARP has played in collaboration with aging network partners, stepping forward through the pandemic. And I must add that she was also a Democratic Party chair. I met her when she was the director of Department of Commerce and Consumer Affairs. And before that, she was the CEO of Olelo Network. So very high-powered person. DERRICK ARIYOSHI, another high-powered person in our midst tonight. For the past 2 years, DERRICK has served as the county exec for the Elderly Affairs Division, for which he is the designated area agency on aging for the City and County of Honolulu. In this position, he supports the administration of federal Title III and state kupuna care services to support older adults to lead independent, meaningful, and dignified lives in their own homes and communities for as long as possible. Prior to this position, he was the state director for the Corporation for National and Community Services. And while in that position, he served as lead federal representative, administering Senior Corps and AmeriCorps Vista grants in Hawaii and the US Western Territories. Prior to CNCS, he served in administrative positions with both the Executive Office on Aging and the Department of Human Services Adult and Community Services branch. So thank you to KEALI'I and DERRICK for being available tonight. I'm going to just talk about a little bit about the Executive Office on Aging. We are attached to the Department of Health, and we run several programs. One is the long-term care ombudsman sits in our office. So if you have a complaint about a nursing facility, if your loved one happens to be in a nursing facility and you have a complaint about that facility, you can call our office, talk to John McDermott, who is the state long-term care ombudsman, and he will go and investigate and help to address that issue. We have the State Health Insurance Assistance Program. It's called SHIP for short. And you've seen commercials on TV with Coach Dave Shoji and the other two guys, Coach Gu and who's the other one? The other.
Leahy.
Yeah. Leahy, the broadcaster. So they do a commercial for SHIP because SHIP helps with people with their Medicare questions, and they help sign you up for Medicare and which plan to sign you up for. So they did a commercial to get people enrolled onto Medicare and to encourage them to call the state Executive Office on Aging if you need help figuring out which Medicare plan to sign up for. We also have the SMP program, which is the state, what is it called? We just call it SMP, but it is for the, fraud and abuse. So if you have been scammed, and they also tell you about what the scams are, the elderly, they put the word out about the scams and the frauds for you to be aware of. Let's see. And also, like, so my job at the Executive Office on Aging is to work on some federal grants. And the grant that I have is to help train people and make them aware of dementia and what dementia is. And if I could share my screen, I'm really proud that we have this, we published this book called the Roadmap, Memory Care Roadmap for Family Caregivers. It's a guide for families caring for a loved one who has dementia. And this roadmap gives you kind of a flow chart. If you're concerned that your loved one has any memory issues, what you can do, there are like some simple screen tests that you could do, and what you can do to help the person keep a healthy brain. These are the screening tools. It's called the 88. It's just 8 questions, yes, no, or you don't know, and it tells you how to score it. Or you can also do a family questionnaire, which is very simple, 5 questions. It tells you also how to score it. And if there are concerns, then you should go and see your primary care physician, because they can do a better workup and do a diagnosis. But this just kind of, gives you a first glimpse of maybe that there may be a problem. Also, if your loved one was in the hospital and they're being discharged, you want a smooth transition from the hospital back to the community, either back to their home or back to a rehab facility. And you can see the 2 choices here and some of the resources that you can access if you want a smooth transition. Then we have a page on a guide to choosing a care option. If it's care that you need in the home, these are some considerations. And if you're considering an option out of the home, so like assisted living facility, nursing home, care homes, adult foster homes, these are some considerations and some tips for how you can choose a provider. And then we have some resources. So for counseling, support planning, some stimulation activity, medication management and therapy, some language resources, resources on driving and fall prevention, wandering, legal and financial help, preventing abuse and neglect, and some safety considerations, advanced care planning, and then some COVID resources. And then we have some helpful hints, what's normal aging and what is maybe a serious memory problem. So there is a difference. So we give you some hints about how to tell the difference, and some do's and don'ts if you are communicating with someone who has dementia, what things to avoid and what things to support them with. And then the stages of dementia or Alzheimer's. So there are the early stage, the middle stage, and the late stage. And this is a MIND diet, the Mediterranean Dash Intervention for Neurodegenerative Delay. It's MIND for short. It's a combination of the Mediterranean and the dietary approaches to stop hypertension, or the DASH diet. So it keeps your brain healthy. So that's what you want, right? You want to stay healthy as long as you can. So here are some foods to avoid. And then from the Alzheimer's Association, this is some 10 ways to love your brain. So don't smoke, exercise, eat healthy, do some brain exercises. And that's the end. So this little booklet, the Executive Office on Aging has some hard copies of the book. If you want me to send you a hard copy, I can do that. Or if you go to our website, you can download the digital copy. There's a digital copy on the Executive Office on Aging home website. So that's what I wanted to share with you, is our nice little roadmap for caregivers. Any questions you have for me on the Executive Office on Aging? You just unmute yourself because we can't see everybody on the screen.
If you don't have questions now, we can put it at the end after everyone finishes. Yeah.
Okay, so I'm going to pass it on to KEALI'I. You have to unmute.
I'm going to
Hello,
stop
everyone.
sharing your screen now,
Thank you.
Debbie.
Yeah. Hello, everyone. Thank you, Steve and Debbie, for inviting me to participate. It's been a long while since I've had a chance to interact with folks from the party. So nice to be here. One of the things that I think is important, and what you'll find from the presentation that Debbie, myself, and Derrick will provide, is that there's actually a lot of resources in the community. And I think sometimes you can get overwhelmed by all of the information out there. And one of the things to do is really just start by educating yourself. So one of the things I put in the chat, and maybe later Lynn or whomever, or Debbie, you can provide a link or an email to those to the participants with those links. And AARP does a lot related to, we pretty much touch most every aspect of ways that people choose to prepare for their lives as they age. In this case, we're going to be talking about elder care, but AARP also does a lot of advocacy work around issues related to livable communities. We've had the opportunity to work with Derrick on those things. And importantly, also, we're able to do a lot related to how to get kupuna engaged and aware and have access to resources related to being vaccinated and such. So for elder care, I think the key piece is just pick a guide, start with one of them. Don't feel like you have to have access to all of the materials. Debbie's office has information that's provides statewide information. Derrick's going to be able to provide that in Honolulu. So for AARP, caregiving is really a very important aspect of the work that we focus on. A big part of that is because, over time, if we're lucky to live long enough, hopefully we're healthy and don't need as much care, but sometimes we don't really have control over that. And our loved ones will, at some point in time, need our assistance. And one of the things that I especially like us to think about as you folks begin thinking about elder care in general is the concept of what I like to call caregiving literacy. And so that caregiving ought not be just restricted to those of us who are at our age, but I also engage my grandson, who's 12 years old, in his assistance in helping me care for my mother, so his great-grandmother. So getting skills around what it takes to take care of a loved one is sometimes something you need to learn as you're growing up, or as Steve indicated, you know, he had the opportunity to spend time with his dad over however many years in caring for him. So one of the things, and I'll share my screen at this time as well. It's just a quick one. It's our basically AARP's website. What I wanted to show is, although we're talking about elder care, AARP.org, we have a really just a wide range of resources for people to think about. Sleep apnea, lots of folks are having trouble sleeping, concerns about COVID outbreaks, but a lot more as it relates to issues of Medicare. That's been one of the big advocacy areas that we focus on. So we have a whole section on caregiving for a loved one. If they're in a nursing home, things that you need to do to take care of yourself. I think if anything, that's one of the most important things. And Mike understands this. You know, Mike DeWitt was talking about that a little bit earlier. We need to make sure we take care of ourselves so we have the energy to be the positive, compassionate, loving caregivers we want to be. And that's really hard to do if you don't take care of yourself and you're really stressed. So I just wanted to go over a couple other things, you know, whether, again, it's you taking care of yourself. So we have this at-home series, what you can do regarding exercise and food, and then other areas related to fraud as well. And so I'm going to put, so I'm going to stop sharing. That's just our, you know, overall AARP website. What I'd like to do is in the chat, I'm going to put, I'm going to also put a link. Oops, not very effective. I'm going to put a link in our in the chat as well about the Caregivers Guide. So one of the things that we have is a Caregivers Guide. In the chat, I've downloaded for you the English version of that Caregivers Guide, but we also have a guide in Spanish, Chinese guide, an Asian American guide, and a LGBTQ guide. AARP is sensitive to looking at and addressing issues related to diversity, inclusion, and equity. And that's part of what we also do as it relates to many of the materials and resources that we provide. Again, I think from an elder care perspective, starting with a guide like this or the roadmap that Debbie spoke of is a good place to start. Again, I think as an elder care caregiver, it can be overwhelming. And I think reaching out to other people and trying to get assistance from organizations like AARP or Debbie's organization or DERRICK is important, as well as your other family members. I think trying to get an opportunity to share the workload or the load of caring for a loved one. And then again, making sure we take care of ourselves and give ourselves permission not to be perfect. I'm going to drop a couple of more things in the chat, but that's just a quick overview. There's just more information than you might have time in a day to get through. But I would encourage you to go to the AARP.org website, as well as the links I'm dropping in there, and really leave a good amount of time for questions and questions people might have. But really want to turn it over to a man that I have a great deal of respect for, hardworking, and I've had the pleasure of working with DERRICK and am excited about his commitment and how quickly he's been able to be flexible and willing to do what it takes to bring resources to the community. So, you know, Debbie, unless you want to introduce him, I'll toss it over to DERRICK now. DERRICK ARIYOSHI from the Elder Affairs Division for the City and County of Honolulu. DERRICK?
Yeah, thank you, KEALI'I. So similarly to KEALI'I, wanted to thank Steve and Debbie for the opportunity to join the group. Knowing the audience, though, it's probably important to confirm no relation to former Governor George Ariyoshi, at least not on his end of the family. I would say that one thing we do share in common beside our last name is a full and healthy set of eyebrows. So that's my feeble attempt at humor for this meeting. So again, thank you for allowing me to join the group. Let me share my screen and I will provide just a really broad and high level overview of our programs and services at the Elderly Affairs Division. Just a second. And then Steve, if you don't mind, if you could let me know if the PowerPoint comes up.
It's up. Oh,
Okay.
It was up. Now it's
No,
gone. Yeah, we see it now.
back on there. Okay, appreciate it. So again, my name is DERRICK ARIYOSHI. I'm the County Executive for the Elderly Affairs Division with the City and County of Honolulu. We sit EAD in the Department of Community Service. The Elderly Affairs Division, and this is an important designation, we are Oahu's area agency on aging. And really our task and charge is to provide advocacy efforts on behalf of our kupuna. We look and engage in community partnerships to improve and expand our impact and services. And a good amount of work is contracting with community service provider organizations to support our kupuna and their caregivers. I mentioned the designation as area agency on aging, important for the fact that that designation established by the Federal Older Americans Act allows us to receive federal funding to provide the programs and services that we do. And we are also Oahu's Aging and Disability Resource Center for Oahu. I mentioned the Federal Older Americans Act, established in 1965, and through this federal act allows EAD the funding support, and I will go over some of the services and programs that we support through this federal act shortly. We have Rep Takayama, very familiar with our Kupuna Care program, built in Hawaii statute that allows us to use state funding to provide, I would say, a higher level of service and care for kupuna with ADL and IADL deficiencies, which I'll provide more details in subsequent slides. So here are some of the programs that are supported to the funding that I shared with all of you. Remember, the Older Americans Act is federal funds, and we have a good array of caregiver programs. Some of them Deb mentioned. And the majority of these programs are contracted out with organizations that all of you may be familiar with, whether it be Catholic Charities, Lanakila Meals on Wheels, Hawaii Meals on Wheels, Palolo Chinese Home. So we have, over 3 dozen contracted agencies that support one or several of these services. We have within our federal funding congregate dining sites, home delivered meals, housing assistance, group health maintenance and disease prevention programs, legal services through Legal Aid Society of Hawaii, and transportation services by Catholic Charities Hawaii. Services provided under our state Kupuna Care program include in-home care services such as attendant care, short-term case management, chore services, also home delivered meals, homemaker, personal care services, including bathing and transportation. I wanted to highlight though, our adult daycare program. That's one, it's a service that we feel is underutilized and under-recognized. So just wanted to highlight that to the group, is that with adult daycare services, right, we now see in the midst of the pandemic, the importance of socialization. So adult daycare really provides that socialization component, but also provide some, personal care. They get meals as well and supports our working caregivers as well. This is really high level eligibility for our programs, for our federal programs under the Older Americans Act, largely age eligibility, 60 years and older. Reminder, our programs and services are intended for dollar of last resort and not to duplicate or replicate any existing services from other government programs. So should not be covered by comparable government or private services and should not be residing in an institutionalized facility, because really our charge is to keep our kupuna in their homes and communities for as long as possible. Kupuna Care Program, same eligibility as our Federal Older Americans Act funds, with the addition of, in order to receive services, they have to perform or unable to perform at least 2 combination of activities of daily living or instrumental activities of daily living. So some of them, like, it's, bathing, feeding, being able to do chores around the house. So it's a higher level of needs for our kupuna care participants. Now, home delivered meals has the highest eligibility criteria. They have to have significant cognitive impairments. They have to be unable to perform 2 activities of daily living and are essentially homebound. Yeah. Again, our priority is to give those with greatest economic and social need, at risk for institutionalization, have limited income, and minority with limited English proficiency and or residing in rural areas. So I would say for our services and programs, right, it's not the be all end all catch all. It's that middle, that gap group where it's not our Medicaid populations, those folks that have higher incomes that wouldn't normally meet Medicaid eligibility, but also those folks that already have financial means and resources. So that's our target population, our task and charge to support that middle group population of kupuna. We also have another volunteer program, a federal grant called the Rsvp program, Retired Senior Volunteer Program. Very excited about this program. Kimberly Itagaki is our program coordinator. So it flips the script. It changes the paradigm, if you will, on how we see and value kupuna. So I think maybe that's the ask of the group, to be excited and to see the potential that when we speak of our kupuna and synonymous, we say the silver tsunami. Yeah, we take offense to that in the sense where they place a negative connotation to that reference, meaning, economic, social drain. If you speak to anyone in the aging network, as Deb and KEALI'I and myself are, we know that is quite the opposite, that there is so much value and potential in our kupuna populations, from their energy, their passion, their life experiences, that are wanting and willing to give back to the community. So that's what this Rsvp program does. It recruits senior volunteers, deploys them into the community to address critical community needs. And we feel that there's so much more potential in this area for kupuna to be actively engaged and actively supporting the most critical community needs. We have
Can I interrupt 1 second?
Go ahead, Steve.
Yeah, I would like to just acknowledge there's Representative Greg Takayama and Councilwoman Radian Cadero in the house tonight in our meeting. I just wanted to acknowledge them. So thank you for coming, and go ahead, Derrick.
Oh, thank you, Steve. So I also provided a link to our Senior Information and Assistance Handbook. This is the Senior Information and Assistance Handbook in particular is really popular in the community, not just by our kupuna, but folks in social service, our health sector, caregivers, because it really is a comprehensive guide to services and programs in our community right now. So I provided the link in there, Steve. We are working with City Print Office right now to print hard copies of this book because they go out fast. And Steve, maybe what we can work through Deb, if any of the groups want a hard copy, we can do that.
Okay, we could ask for a few, I think.
Okay, no problem. Want to be respectful of time. Two areas that we supported during the pandemic and incredible support from AARP, KEALI'I in pulling these two community-driven initiatives together, the Kupuna Food Security Coalition and the Kupuna Vaccination Outreach Group. These are some of the media highlights of both those efforts and some of the impact made to address needs for kupuna vaccination and food resources. So over 1.2 million meals and wraparound services provided to kupuna during the pandemic. Over 1,000 kupuna vaccinated at 60 low-income senior housing properties, and over $1 million in resources for meals and food, and also worked to set up a kupuna vaccination call center that received at a high point over 200 calls per day to assist kupuna to register for vaccines. So with that said, Steve, thank you so much for the opportunity. I wanted to acknowledge KEALI'I with AARP and Deb at EOA, because these are unprecedented times, but I think you speak to any of the stakeholders in the aging network and they'll tell you that all our stakeholders stepped up in a big way to support our kupuna in the community. Thank you so much.
Okay, thank you. Before we go into questioning, does Greg Takayama want to say anything?
Thank you, Steve. I think I'm very lucky to have the opportunity to hear directly from KEALI'I and Derrick, and of course our own Region 5 member Debbie. These are very valuable members of our community and leaders as far as our taking care of our kupuna are concerned. One message I do always emphasize is that when we as Region 5 members talk to our fellow neighbors or even our legislators, because every once in a while I'll hear from down at the Capitol, why do we hand out so much money to our seniors? They vote, so that must be why we give them money. And the thing that I always emphasize, and you heard it from Derrick and Debbie as well, is that these are not handouts. The opportunity is there for us to reduce the amount of people living in nursing homes, in care homes, in institutions, because these are people who, by and large, want to live at home independently, just need that little help from government to do so. And when they do have to be institutionalized, guess who ends up picking up most of the tab? And when it comes to Medicaid, it's not free from the federal government because we foot the bill as well, half the bill. And so it's really an effort to not only satisfy the needs of the kupuna in our communities, but it makes common sense and it makes fiscal sense. And so, I use Derrick and KEALI'I and Debbie's programs as examples of things that make sense, that don't cost a whole lot of money, and that in the end serve all of us in the community. So thank you, Steve.
Thank you, Greg. Councilwoman Radiant Cordero, do you want to say anything?
Hi, Steve. Thank you so much for allowing me to join Region 5. I'm your neighbor in Region 4. So Thank you for letting me join you all. I was really actually drawn to join you all tonight because of the topics and the speakers. So I really want to thank KEALI'I, Debbie, and Derrick for being here. The reason why I wanted to come here is basically what Rep. Takayama said. But also on the city side, I'm really proud that we are striving and working towards becoming an even better age-friendly city in Honolulu. And for me, if we build a city for all ages, especially our kupuna, I think that then we are succeeding in creating a city for everyone. So thank you all so much for letting me just be here, be a fly on the wall, but definitely just here to learn from you, learn and hear what kind of questions Region 5 has. And yeah, thank you all again so much. Appreciate it.
Thank you, Councilwoman. Thank you. Okay, so we're going into the question program. Does anybody have a question that they want to ask?
So Steve, in the chat room, there's a question from Rosabella. How to join the RSVP program to volunteer?
What is the RSVP program?
Well, Steve, that's the program I was sharing that
Okay.
recruits kupuna volunteers. Yeah.
Okay.
Yeah. So give our senior information call center a call and let them know that you want to be a volunteer. So 768-7700, 768-770-7700.
Thank you.
Steve, if I could just add one other thing, just as Representative Takayama talked about some of the caregiving resources or allocations that the state looks at, the federal government is also looking at that right now in the budget reconciliation. And one of the things that AARP is advocating for is credit for caring. And it, if passed, would give family caregivers a one-time $6,000 payment to help offset the cost for caring for a family member. Now, keep in mind, this is for those who care for their loved one at their residence. So as Rep. Takayama indicated, many of our kupuna want to be able to age at home. And it's not to say that these other facilities aren't wonderful. For many people, it's a healthier environment for them to related to their comfort and their familiarity with the surroundings. So we're really hopeful that Congress, one, passes the reconciliation, budget reconciliation, and that credit for caring is included in that. That's a big push that AARP is also involved in. There's a whole lot. You could probably do an entire session just on the issues included in the budget reconciliation.
Right, thank you. So I have one question that's being relayed from a friend. They don't want to go on. So they're asking is, they take care of their mom and dad. Their mom and dad are in their 90s and they don't actually leave the house, but him and his wife are getting burnt out. And they want to know what kind of program that, just to give them a, maybe a date night or something that they could do. Who would they contact? Any one of the three on the board, on the panel.
Well, I think if you can find basically some of the programs that are out there are respite programs, meaning they're designed to actually for that purpose, is to give you a break and allow you to get some time. Ideally you can get that from another family member. And if you can't, those services would be helpful. For AARP, it's a little bit challenging at this time, partly because of the pandemic and the degree to which you have people who could, unexpectedly either get exposed or expose your loved one. I'm not sure, Derrick and Debbie might have more specific county or state programs that provide some kind of respite support.
Oh, I think your suggestion and recommendation is correct. Again, dependent on financial resources, right? I would So here's the deal, is that there's no amount of government funds and programs that can support the comprehensive needs of the community. So yes, KEALI'I is right. The first place you look is for informal supports from family members. And from there, if you do have financial resources, you can explore some in-home care services, including attendant care services from some of our in-home care organizations.
Okay, thank you.
If you have a couple people with their hands raised, Cindy and Martha.
And the lineup will be Martha Randolph first.
Okay, this is Martha Randolph. I'm president of Precinct 4 in District 25. My question concerns elders who are living in their own space, whether it's their home or a very long-term rental, whose finances have been changing, and they need some rental assistance, not a lot. Let's say they have Medicare, Medicaid, they have people coming to help them. But I know a lot of seniors in our neighborhood who rent out either a room in their house or another unit so that there is someone living with them, but who doesn't take care of them. That helps with the rent, and it helps with feeling protected. Because if you're a senior, you don't necessarily want to live alone. We had some seniors who were attacked here on the Hill unexpectedly, and no one knew what was going on, and they were living alone. And this was in the middle of the day. Are there programs which provide assistance, or that they can apply for assistance for whatever their housing expenses are, whether it's taxes or rent or whatever, but that allow them to have someone staying with them, even though that person is not a family member or a caregiver? Thank you.
Martha, I know that there are some right now during the pandemic short-term rental relief programs, but I think to your larger question, where I think there's a lot of potential right now is a home sharing program being supported by Hawaii's intergenerational network. Chuck Larson is the executive director, formerly of Siegel Schools. What Chuck is building up right now inventory on is the matchmaking of kupuna that have their own homes, but are struggling to have supports to allow them, just everyday household upkeep. So what Chuck Larson is building up inventory on is having an inventory of those kupuna, and then on the opposite end, students, other individuals that are needing housing support and willing to provide support services and general upkeep of the home for the kupuna. So I think in part that may answer your question, and I think it's a model that has a lot of promise, and it's been done in other states, and would really like to see that gain some traction and momentum. Not sure if Deb or KEALI'I can add on to that.
No, I was just going to say, Martha, I don't have anything to add to that. That is a very important area that still needs a lot of work. And seeing that Chuck and others are beginning to look at that, ARP would be very interested in looking at what Chuck and others are doing in that regard, and see if we can lend some support.
Right. Can I just double check and make sure if I'm right? All of the financial support for housing that exists in Hawaii, whether it's county-based or state/federal based, require that the individual be living alone or a family group. There's nothing that allows for a person to be living in any kind of shared capacity, even unless it's a family member. Or if you guys don't know the answer to that, that's fine.
yeah, Martha might have to take that back for a little bit of research on that one.
Right.
No worries, thank you.
Steve, I think Cindy had a question.
Yeah, so I think I just have two quick questions. So one, I mean, I work in healthcare, right? And a lot of times what we're not clear on, and a lot of times our barriers for our patients, especially for our elderly patients and their family members, we don't have like a case manager that's in their internist's office or in the clinics unless they're already at a situation where they're already in a bad state of mind, where they're already inpatient in the hospital. So for like preventative care and information, how does the healthcare organizations, whether if it's Queens, Straub, or Kaiser, how are their general practitioners, are they aware of these types of resources and services to provide these types of information to their patients and to their family members? Because when I worked in primary care, I don't recall ever being trained or being, I would have, like, I'm glad that I attended this meeting because I've never heard like these types of presentations, and you guys did awesome. And I think we need more of this types of educational purpose, because one, whether if you're working in healthcare or any type of industry, we do have barriers in regards to having to take time off to take care of our families. So this is something would be important for everybody as a whole.
Cindy, I agree with you. I think that's where there's so much potential right now. And you being in the industry can speak to this, that we see a changing in how we view services, right, for kupuna and just the population in general. It's more of that holistic services and well-being of the individual, including meeting their, not just their health needs, but their social needs as well. Yeah, so we're moving in that direction. I think in the growth and development of that model is where I think the challenge and opportunity for us is to make sure that on the health side and then on the social service community-based program side, that we already start building more synergy in between our organizations and how our services complement each other. So I'm going to take what you said as a challenge and wrap it around in a solution. And I think that's a conversation we want to have for our partners on the health sector side, and hopefully we can move the needle between both sectors. Yeah.
And then one last question, and this is super easy. I know you had highlighted all these different community organizations like Catholic Charities and Meals on Wheels. Is there a way that for either the Democratic Party or Region 5 can, highlight these types of, organizations for us to assist, or, put in like a pamphlet or a flyer saying these are all of the organizations that assist with all of these kupuna care services, and if you want to donate or volunteer, you can volunteer in all of these any of these organizations.
That would be awesome. Let me, for sure, I want to take an opportunity for our service providers to do that. Let me kind of debrief with KEALI'I and maybe Deb in the best way to take advantage of that kind of opportunity. That was really nice of you, Cindy.
You're welcome.
Our
Absolutely.
would be thrilled.
Yep, and Cindy, I would just add, and this is only from my own experience, from when we've had to have my mother have to go into the hospital for whatever reason, especially now with COVID. We frequently have interfaced with the hospital social worker as part of our being discharged. And that's where they're often asking us what kind of services we're interested in and what might be available. The degree to which they have a broad range and understand all of these resources is a very good question. And I would actually tag team Debbie and see whether there's really an opportunity, as you say, for us to pull together a webinar of sorts and work with some of the hospital providers and such to see if they have an interest in understanding what we do. So that's a great idea. Thank you, Cindy.
You're welcome. And Lay's up next, and then Mike is after Lay. Thank you.
I have several questions, yeah. One of them is that several weeks ago, we were told that I live in Wahiawa, that Wahiawa and Waianae had the lowest vaccination rate in our state. And so I called the city and I called the state to find out who are the ones that were not vaccinated. And I was thinking probably seniors. And they all gave me the same story that there's a certain percentage don't want to get vaccinated, but they couldn't say, they could identify who, or what type of people. And we have a lot of military in our community. So was it the military? Was it, and then, so when I'm a kupuna myself, and in thinking about the elderly, there are a lot of people living by themselves, as someone else mentioned. And does the state know where they all are so that they have been approached, especially if they're living by themselves? And so I'd like to know more about it. And is there maybe a survey that someone has created that you could go in a neighborhood and ask, go door to door and ask people if they want to fill the survey out as to whether they would like to be known by an organization so that if they need assistance, they can, we can help them. And I'm a member of the Lions Club, and I approach this concept that maybe once we could have a project where we're helping, or maybe get people together to call them, the ones especially living by themselves, to see how are you, that because sometimes they might die and no one knows they've died, But is there some kind of a way you folks find out who the seniors are that are, and not everyone get their daily newspaper to find out things or whatever, yeah. But that's one of my questions.
I'll start. Derrick's done a great deal regarding that. And like I said, it's just been wonderful to work with Derrick and the Executive Office on Aging. So there is sensitivity around, necessarily calling any one group out as not being vaccinated and maybe perhaps being the cause for the increase in the Delta variant. But I wanted to just share my screen with you real quick. And so the Department of Health has their, if you haven't seen this, the Department of Health has in their disease outbreak piece, and I'll put a link to this, but what they have is information around the vaccination rates for each of the counties. And so if we go and look at age as an example, it'll show you that kupuna are very well situated. So we've got here as an example, 100% of kupuna 65 to 74 have at least initiated. So it means they at least got one shot. And then 98% have gotten, or have completed their vaccination. So we can see that kupuna in general are leading the charge, so to speak, of those who are getting vaccinated. But you can take a look at race as well. It's a little bit difficult because these race or ethnicity wasn't a requirement. When you go into Longs and get your COVID shot, they're not asking you what ethnicity you are. So, I think there's these broad categories that you can see here where there's a percentage of people who are vaccinated compared to what the percentage that group makes up of the population. And again, you can also go to the map, Lay, and again, I'll put the link in there. And so you can go to Oahu as an example. Well, I'll just pick, sorry, I should have picked Honolulu as the county. And then you can see here, it gives by color. Again, we really aren't wanting to call people out, but you're right, Lay, according to this, in your area, 35% or less have been vaccinated. In the Waianae Coast, I'm not sure why it's 35.1 to 45%. And then you see these darker areas where the percentage of vaccinations are higher. We do think it's great that the state is providing this level of detail. It took a long time to get to this point for a lot of different reasons. So again, one can look at the vaccination rates based on some of those things. The reason I wanted to make sure you have an opportunity to hear from Derrick on this is there are services that the coalition that we're part of, the Kupuna Vaccine Outreach Group, have put together to address some of the issues of how to get people vaccinated. So I'm going to turn it over to Derrick, and I have to figure out how to stop. Okay, there we go. Stop sharing my screen.
So I'll just add on, Lei, to what KEALI'I shared, is that we actually, for Kupuna now, older adults are leading the country now in vaccination rate. And it's not because we vaccinated, 90% of the Kupuna. We lead the country because we vaccinated the 10, 15% of the hardest to reach access challenge Kupuna is why we lead the country. And that strategy was built around removing as much barriers to get vaccinated as we can. I would say one opportunity right now, if you know of Kupuna that are live alones and may not have informal or family member support to get vaccinated at a site or pharmacy, is that Department of Health now, we help support and had dialogue with them to stand up now a vaccination in-home program with really no eligibility restrictions outside of just needing in-home vaccinations. KEALI'I, my apologies, I don't have the DOH number readily available to me.
I'll go see if I can find it, but yes, I know which one you're talking about. And Lei, especially Wahiawa, the partners that Derrick's talking about, and again, my reason I say Derrick and the Department of Health in this case have been really good to work with is they've also reduced barriers to figure out how to just get the resources out there without jumping through a lot of red tape and hoops. And Derrick in particular has been more than willing to think outside the box on these services. So being able to have something like this, and Lei, Haleiwa and Wahiawa are especially places that many of the providers that are partnering on this want to be able to get out there and get those calls. So I'm going to look for the number that Derrick's referring to. I know you had a few more questions, but I don't know who else we had.
We have
who had their hand up.
We have Mike Dewart, and then we have Carol, who is next. So, sorry, Mike first, and then Carol will be after Mike. Thank you.
Aloha. Yeah, I've heard a lot about Kupuna who are living alone and Kupuna who are having their kids take care of them. But a lot of spousal situations have two elderly people, one taking care of the other with no kids and no family locally. And I'm fortunate to be in a position where I have a job where it makes sense to hire a home health aide for 40 hours a week so I can work. But a lot of jobs don't provide that kind of income. And so you end up with a caregiver forced into early retirement by the burden of caring. And then that can lead to a spiral where both of them end up in poverty. Because spouses have an absolute duty financially to care for their spouse. So that's I'm not in that position, but I have such empathy for people who are, because I've seen people have to lose their homes, lose what's left of their careers to deal with this. So I don't know if there's any city or county programs that actually address the elderly spouse taking care of another, cognitively impaired elder. I don't know if anybody can address any of that issue.
Yeah, no, good question, Mike. And I think that's why I shared with all of you our adult daycare services. I would say that's one service that may in part support spouses who are having to serve, who are still in the workforce, but needing supports for their spouse. Adult daycare service, I think, is a great service that allows the working caregiver to stay in the workforce, to ensure when they go to work that they know their loved ones are cared for. So that's the first place I would probably look for services and programs, is that if you have financial resources, that's always the best way to go. But really, we're not in the mission of putting anyone in poverty if we have the resources or programs that could support. So I would say if the spouse does not have the financial resources, are not Medicaid eligible, then that would likely be a program service under our portfolio that may be able to provide support.
So Kapuna care is a little bit difficult right now because of the COVID situation. The other question is how much care, I mean, in the sense that if you need help with multiple ADLs but you're still ambulatory and very strong-willed and likely to just walk away from the facility, well, and that was one of my concerns, is would it actually work in those kinds of situations?
Yeah, that really depends on, like you said, the cognition issues that may be present, it sounds like, right? And that would really be dependent on the organization, whether it be adult daycare or a higher level like adult day health, if they could support the needs of that spouse, if there are some cognition issues that are present. Yeah, but I wouldn't rule out a potential for support for adult day or adult day health services. I still think that's the way to go in the situation that you're sharing. And we do have adult daycare centers that are open right now during the pandemic. But as cases rise, as the Delta, we had a good number, I'll tell you, that have also temporarily closed shop.
Thank you. Thank you.
And then we have next is Carol.
Yeah, actually, Derek and Mike kind of answered my question, because I'm just beginning to care for a person who's beginning of dementia, and Debbie talked about the importance of socialization. So I was interested in the adult daycare for this person, and but I guess Derek answered my question that many of them are closing because of the numbers.
Yeah, we do have some still open though, Carol.
Okay.
So I wouldn't rule that out. Good to see you, one. And also want to mention that Deb shared already too now. We have the loved one that's needing the care, whether it be in-home or adult daycare center, but we can't forget the supports of the caregiver themselves, making sure they take care of themselves, mind, body, spirit. So we do have support groups, caregiver counseling and education, for example, through the Alzheimer's Association that we contract with. So
okay.
Yeah, I'll share that with you.
So to find out what daycare centers are still open, do I just call your office?
Yeah, give our office a call, but want to be transparent, yeah, because when we counsel and refer any individual that comes from the community, we want to have a good holistic view of the situation to see if, are there informal supports available? Are there financial resources available? And then, so we'll ask those kind of probing questions and do our best to kind of put the pieces together.
Nice. Yeah. Thank you. Appreciate that.
Carol, I've also put in a link, and it's a caregiving/health. But in that particular case, it's primarily around resources that AARP has related to caregiving for loved ones who have dementia or Alzheimer's, but it's not specific to resources here in Hawaii, although I provided another link. The other thing I would add, and I just appreciate what Rep Takayama spoke to, and whether the contact is Debbie or Larry, is there are times where we're having to defend programs at the state legislature, and I know there's a lot of competing demands, and for services and programs for caregivers, I think it would be great to be able to see if folks from the Democratic Party would be willing to support some of the legislation around that particular issue. But Rep Takayama is your best bet in that regard. But I think that's just another area of focus. I know it's not related to your question, but I just wanted to raise that as a point.
Thank you.
Thank you.
If I could I just add, this is Greg, but in answer to Carol's question about adult daycare places, there is one right in our own Aiea area, Waimalu area, in the Mary Savio building. It's called the Hale Hau'oli Adult Daycare, and it's one of the larger ones in town. So just if you're looking for a place, that is one of the few that are open. So just wanted to add that. Thanks.
Thank you, Greg. And we know our own Kathy Wyatt is the executive director of that particular adult daycare center. So Kathy has been a longtime champion of just the aging field in general.
Oh, yes, exactly.
Yeah. Wanted to add on real quickly. I would be remiss if I didn't add this. And KEALI'I touched upon it too. Cindy, I suspect you might have opinion on this. What we've seen in the pandemic is really the importance of online access. We talk about the digital divide, right? That's a direction we're already in and moving towards. We talk about telehealth. Everything is moving into that direction. So I think for the party and Region 5 and just within your community networks is to kind of keep that in mind, where how do we ensure that we build, and this is an AAARP priority, I know as well, that is mindful to make sure that our kupuna, regardless of demographic or social class, has access, online access, has the tools and training to be able to access the programs and services that will move towards online. Yeah. So Cindy, I think even in your area, yeah, that the industry movement is towards more telehealth, teleservices.
Yeah, it's just it's a little bit challenging for our seniors, especially those that are not familiar with how to navigate the internet, right? And sometimes it's not that very user friendly. So at times they do need some extra guidance and support. And, especially, I'm part of the Lions Club as well. And we have a lot of seniors, right? So, hearing stories on how that just even Facebook and social media, like even that is something of challenge, right? And they want to interact with folks and see and talk story. And, our seniors always want to have that personal touch with somebody. And that's the only thing, the difference between technology versus a real life person. And you see the difference between how mainland folks and here in Hawaii, our people just don't want to deal with folks in the mainland, or they want to deal with somebody locally at times. So that's the challenge, and that's just our culture here in Hawaii. So, but I agree with you, Derrick.
And just to let Derrick know and anybody else in this meeting, that the Democratic Party does have a broadband committee that's working on exactly that, right? Trying to get technology out because of our conventions are going to be digital next year. And so they want to educate the Democrats and get them tablets so that they can participate in the convention. So we are moving as a party in that direction as well.
That's fantastic to know, Debbie, because as Derrick said, it is a priority for AARP. AARP Hawaii was one of 7 states that were able to get funding from our national organization to focus on broadband issues. And so we're working on that and working as a subset to the state's broadband hui, whoever all those people are. And our Derrick is part of this group, but it's basically the kupuna broadband hui that's a subset of that. And we're going to be looking at issues related to digital inclusion and developing a digital inclusion roadmap. So be excited to, maybe identify or speak to whoever is taking the lead on that for your group.
Okay. So mahalo, everybody. It's almost 8 o'clock. It's coming to that witching hour.
Can I
go ahead,
ask?
Lake.
Okay, because I didn't ask my other question. It's on the same subject matter, what they're talking about. My question was, how do you find out all these things, that are online or on TV or whatever? I only find things out by accident. So I finally joined KEALI'I, AARP. So maybe I thought I'd get some communication as to what activities are going on that I can, on my computer, find out about, like classes and how to use the internet, and also exercises and things like that.
Absolutely.
So I'd like to really know, how do you find out about it, that it's available?
For AARP, absolutely. If you're a member, you'll get numerous emails related to different programs that we have here in Hawaii, and then also national ones. And they'll focus not only on just programs like we have a really wonderful cooking show, by the way, exercise, Zumba, just a broad range, but also community activities, but also advocacy, like the issue I brought up about credit for caring. There's initiatives that AARP does. It'd be great that there was one central place that all of the activities or resources for kupuna could be made available. Maybe that's something that in our extra time, Derrick and I can talk with some of our partners out there about how something like that could be made available.
Okay, thank you all. I want to thank everybody. Thank you all for coming to tonight's meeting, especially mucho mahalos to Debbie, KEALI'I, and Derrick. I also have some comments in the chat room still yet. If please read it before you leave. And I just have one last on my when I sent out the invite for this meeting, I had put some dates that are of importance, and one of them has been corrected. The Central Committee has changed the date of the state convention. Now it's going to be May 27th to May 29th. The one that's listed on the on my flyer is incorrect, so just make that correction. And thank you everyone for coming, and thank you, Lynn. You can stop the recording.